Hi, my name is Allison and I'm a therapist here at Complete Physical Therapy. Today I'm going to talk to you a little bit about plantar fasciitis and some ways that you can stretch to decrease pain. First and foremost, our plantar fascia is a connective tissue on the bottom of our foot, connects our heels to our toes, and it's actually a part of a bigger fascial line that goes all the way throughout the back of our legs, calves, hamstrings, back, and even into your neck and head. Oftentimes, symptoms are worse in the morning. So I'm going to go through some different stretches with you that you can do before you even get out of bed in the morning. So one of the first ones is you can go and take my shoe and sock off, is just simply pulling your toes back. So even just pulling back kind of creates a little bit of a stretch, and you even get a little bit of a stretch in through the back of that leg. So you can hold that there to your tolerance, just to kind of slowly release a little bit of that tension. So a lot of times with plantar fasciitis, it's really an inflammation of the soft tissue, and over time we develop little tears, little micro tears that will heal with scar tissue, and that scar tissue is really what we want to try to stretch out and kind of work out. That's a lot of times what causes a lot of that pain. While you're in this position here too, you can kind of start off by doing your own muscle or myofascial release. If you have a certain area that's really tender, you can kind of push and rub on those areas. You'll notice too, as you pull your big toe back, some of those tendons and that fascia will expose itself. So you can kind of strum up those tendons. But of course, finding those areas that are the most tender and just being gentle with it. Another great strategy for this is using a lacrosse ball. So this is one of our favorite tools we use here in the clinic. You can kind of apply that same pressure through the ground. You could add a little band to the toe here. This also can help pull back as well. And then just slowly strum that lacrosse ball throughout that bottom of the foot. So this ball is helping to break up that scar tissue. And it's also helping to promote blood flow to the area. So we want to create that healing process. So that blood flow will bring in healing properties. You can just spend a few minutes in the morning just kind of working through that before you even get out of bed. This is also a strategy you can do intermittently throughout the day to manage symptoms. Another quick thing I'll show you is some releases along the back of your leg and your calf. So that plantar fascia goes all the way through and connects to that fascial line through your calf. So using that same lacrosse ball, you can kind of start along almost your Achilles tendon or lower, throughout that lower part of the leg, and just kind of roll that ball along those tender spots. If you find a tender area, you can just let it sink in, and then add in some ankle pumps. So as you pump that ankle, you'll notice that stretches more as you bring your toe to you. Using that same strap, if you want, you can also have this as a little helpful tool to pull back on your foot. You can really feel how that stretches, working your way all the way up in towards your calf. With these muscle releases, find a tender spot. You can just let it sink in for maybe a minute or so, and then after that minute, add in those pumps, create that active release. And these are just a couple of ways that you can stretch in the morning and throughout the day to help manage your plantar fascia symptoms.